All right. All right. Hi, good afternoon, morning your time, Janet. I
I
really appreciate you willing to talk to us and kind of tell us a little bit about what's going on in your life over the past year or so. We first met last October, and you had a lot of pain from an accident. Tell us a little bit about that and where you were.
in May, I I fell behind the house. I shouldn't have been back there. But I was, and I think I did like a forward whiplash almost because
Mm-hmm.
I landed on my knees and I flew forward, and what I had in my hand was 6 feet away. It was quite traumatic, and I was more worried about my knees because I had just about 4 months before I had just had a new knee. And I sat there kind of stunned, and I got up. And from the time I got stood up, almost immediately I started having horrendous pain on here, like this, and even moving my eyeballs was horrible.
Yeah.
Long, long story short, I did not know what was going on, and I lived my life in my chair. When I had to go someplace, I was like this, trying
Mm-hmm.
not to turn my head. But I tried everything. I tried acupuncture. I tried craniosacral. I tried regular physical therapy. I guess that's part of the craniosacral. And
Mm-hmm.
acupuncture. I tried drugs. They did not work at all.
Yeah.
Nothing worked. And so last summer, oh, and also in like July, I believe it was, I went to Swedish Hospital in Seattle. I live in Alaska. So
Mm-hmm.
I flew to Swedish Hospital to go to this pain doctor down there and the neurospinal specialist.
Mm-hmm.
And he did some, called them nerve blocks, but they had cortisone in them.
Mm-hmm.
And I noticed the evening, not my pain sort of went away for about an hour or so, and then it came back full bore, and it
Mm-hmm.
was never left me again.
Yeah.
And so I spent the best summer that Ketchikan, Alaska has ever had doing absolutely nothing.
Yeah.
And then I saw your interview on a Facebook post with some young lady that had to do with
Mm-hmm.
occipital neuralgia.
Yeah.
Oh, and by the way, that pain doctor, one thing he did do is tell me that I had occipital neuralgia. So I knew that I had it. And I also did that NUCA, which is an upper
Mm-hmm.
cervical
Yeah.
correction.
Yeah.
Normally, nothing.
Yeah.
So then I
Yeah.
saw you, and the rest is history
Right.
because
So
I
yeah,
made an
ultimately
appointment with you. Mhm.
we diagnosed you with greater, lesser, and third occipital neuralgia. We did an operation to decompress the greater, and the lesser and third occipital nerves were injured, so we ended up cutting them and burying them. Um, Long and short, to use your terminology, here we are 6 months later. What's going on?
I have no occipital neuralgia. I have no pain, nothing. I mean, my neck has been bad since I was in my 40s, but my neck hasn't even been bothering me the last month or so, which is kind of weird. But I, right afterwards, I came home and I was like dead from
Mm-hmm. Yeah.
back here all the way up here. I mean, it was kind of odd to get used to it. You'd lay
Mm-hmm.
down to brush your hair, but the pain was just about, I would say, 80% gone.
Yeah.
And for a while, I kind of wondered, do I have another nerve in there? Because it still bothered me up in here a little
Mm-hmm.
bit. And I was just patient. And then gradually it started going away. And last time we talked was a month or so ago. And I
Mm-hmm.
think you asked me about how numb it was. And I said, yes, it's still numb. But now it's just not numb because I can do this and feel it. But when I lay on something flat, I feel a little bit off center. Like
Mm-hmm.
you can
Yeah.
tell it feels a little bit different. But other than that, I mean, I have my life back. I can't believe it.
And turn your head for us. Yeah. Right. So, I mean, I think your story illustrates so many wonderful things, and I really thank you for sharing it. I think that number one, it shows how well this operation can work. Number two, I think that it highlights the fact that when you catch the problem relatively early on, which is to say you've had, by the time we saw you, 6, 7 months of symptoms, um, which is, may seem like forever, but is actually a relatively short period of time. The average amount of time it takes to see somebody like me from the onset of symptoms is 19 years. That's a relatively recently published article. And, if I'm hearing you correctly, numbness aside for a second, your pain is gone. Like the
Yes.
occipital neuralgia, you don't know what that means anymore.
No, it's
Yeah.
gone.
And so I think that, it really shows that if you catch the problem relatively early on, which is not to say the day after you hit your head, because that's a little too aggressive, but it can really get a home run result. The other thing that I think your story points out, which is really good, is that, initially many people have a lot of numbness in the back of their head because those nerves are stunned that we operate on. They don't like to be operated on. And certainly the cut nerves cause a little bit of numbness at first, depending on which ones you cut. But as your story also illustrates, number one, the degree of numbness you have, if I'm hearing you correctly, and I don't want to put words in your mouth, is relatively minimal. And you're about 6 months post-op and it continues to get better. And my suspicion is when we check in at a year, you'll say, I don't really have much in the way of numbness that I notice very much. And that's just the recovery of those nerves from a big kind of manipulation that they don't typically undergo. So
Right.
I want to give you the last word. Again, I want to say thank you for giving us your time. If you have anything else you want to say, I'd like to give you the mic, and otherwise I'll just let you go back to your life that you have again.
I would just like to say, first of all, that don't let your age stop you from having this done, because I'm going to be 80 the month after next. And I have done amazingly well. And I have my life back. And it hasn't taken that long. And a lot of times 80-year-olds or 70s, it takes a long time.
Mm-hmm.
And another thing is, don't be afraid to travel, because I traveled. You do have to have somebody with you while you're there. My sister came from Ohio, and I flew up myself from Alaska, but then I flew home by myself. Surgery was on Thursday, post-op was Friday, and I flew home on Saturday. And so I don't want anyone to think, oh, I couldn't do that, because believe me, if I could do it, anybody can do it.
Well, I appreciate that. And those are actually really great words of wisdom. So once again, thank you for your time. Best of luck with anything. We'll check in one more time in 6 months, which will be a year. And hopefully I don't have to bother you anymore after that. All right. Have a great day.
No bother. And you have a great day too.
Cheers. Bye-bye.
Okay. Bye-bye.